Welcome back to Vitals and Beyond. Today, we're going to explore one of the most critical interventions in intensive care medicine, tube ventilation, also known as mechanical ventilation. We'll break down what it is, how it works, when it's used, common ventilator settings, potential complications, and how patients are eventually weaned off the ventilator. Tube ventilation means supporting or completely taking over patients' breathing using a ventilator connected to an artificial airway, usually an endotracheal tube inserted through the mouth into the trachea. Less commonly, if long-term ventilation is needed, a tracheostomy may be performed. Key goals are to ensure oxygen delivery, carbon dioxide removal, airway protection, and to reduce the work of breathing when the patient is too sick or too weak to do it alone. A ventilator is essentially a sophisticated pump. It delivers oxygen-enriched air under pressure into the lungs and allows passive exhalation. Ventilators can be programmed in different ways. Volume-controlled modes. A set tidal volume is delivered with each breath. Pressure-controlled modes. The ventilator delivers air until a target pressure is reached. Or support modes, where the patient initiates the breath and the ventilator assists. Settings that are frequently adjusted include tidal volume, which is the amount of air delivered per breath, respiratory rate, how many breaths per minute, FiO2, which is the fraction of inspired oxygen, and PEEP, which is positive end expiratory pressure, which prevents the alveoli from collapsing at the end of exhalation. These parameters are carefully balanced to optimize oxygen delivery while minimizing harm. Tube ventilation is used when a patient's respiratory system fails or when airway protection is required. Indications include acute respiratory failure from ARDS, severe pneumonia, or pulmonary edema. Exacerbation of chronic conditions such as COPD or asthma attacks, neurological conditions like coma, traumatic brain injury, or spinal cord injury that impairs the breathing muscles. Airway protection after a cardiac arrest, poisoning, or severe trauma, or surgical anesthesia, or major operations requiring full airway control. In short, if a patient cannot maintain gas exchange or protect their own airway, ventilation is often required. To understand tube ventilation, we must revisit basic physiology. The lung's main role is gas exchange, oxygen in and carbon dioxide out. Mechanical ventilation ensures oxygen reaches alveoli, even when the patient's own muscles fail. At the same time, it helps regulate an acid-base balance by controlling CO2 levels. This is crucial in conditions like respiratory acidosis, where ventilation buys time for treatment to take effect. While life-saving, tube ventilation carries significant risks. Ventilator-associated pneumonia, due to bacteria entering the lungs via the tube. Barotrauma and volutrauma. High pressures or volumes can injure delicate alveoli or cause pneumothorax. Oxygen toxicity. Prolonged high FiO2 levels can damage lung tissue. Airway trauma from the tube itself, or delirium and ICU weakness due to sedation and immobility. Managing a ventilated patient requires close monitoring. Ventilator waveforms and alarms show how the patient and ventilator interacts. Pulse oximetry and arterial blood gases provide data on oxygenation and ventilation. And chest exams and imaging help identify complications like pneumothorax or tube displacement. Nurses and doctors work together to titrate oxygen, PEEP, and sedation while preventing complications. The ultimate goal is to liberate the patient from the ventilator. Once the underlying issue improves, the team assesses readiness to wean. This may include spontaneous breathing trials, gradual reduction in support, and monitoring for fatigue or desaturation. If successful, the patient is extubated. If not, support continues until they're stronger. In cases of prolonged ventilation, a tracheostomy may be considered. Tube ventilation is one of the cornerstones of intensive care. It keeps patients alive when their lungs cannot, giving them time to heal. but it also requires vigilance, teamwork, and constant adjustment. For healthcare providers, understanding how it works, when it's used, and how to manage complications is essential. Thank you for watching Vitals and Beyond. Don't forget to like, share, and subscribe for more clear explanation of complex medical topics.